you want to understand entitlements, you have to look through the lens of how state by state it's being dealt with and how that telescopes onto what the needs are for the nation, okay? That's how it works. The state of California is shelling out a lot of money for illegal immigrants. And now there's a concern that it may strain the system so much in the state that they're going to have a real financial issue. What does that say about the state of play in that state, but more importantly about what we need on the federal level? California member of Congress, Republican Kevin Kiley, he claims that, you know, the state's going to need a massive bailout to shore up the state's Medicaid program. We also have another member of Congress from California, Democrat Brad Sherman. And before we begin, thank you both for taking the opportunity to come on with a member of the other party and show the audience that we can be reasonable and not just right and left. So let's talk about your state, but then let's talk about what it means for the country. Kevin, I'll start with you. Brad, thank you for joining us as well. What is your concern about what's happening in California?
Well, thanks, Chris. My concern is that the Medicaid program is becoming insolvent in California. The cost of providing universal comprehensive coverage to every illegal immigrant in the state has ballooned. It was supposed to be a few $1 billion. It's now $9.5 billion just for this year. The situation is so dire that Gavin Newsom has just taken out an emergency loan from the general fund to cover costs. And in addition to that, he's asking the legislature to appropriate more money to cover what is overall about a $6.2 billion shortfall. So if you project this over a 10-year time horizon, we're talking about potentially hundreds of billions of dollars that's going towards free, universal, comprehensive health care coverage for every single person in our state illegally. Meanwhile, legal California residents who are on Medicaid, in a lot of cases, are not being well served by the program because the reimbursement rates are so low. In a lot of parts of the state, you just can't even get an appointment with a doctor. So it's a very clear example of how we're taking funds that could be used to provide better access and care for our own residents, and instead using it to further entice folks to come to our state illegally.
So, Brad, this was a big macro issue in the last election, is how Democrats were deferring to people who aren't here legally and straining the system. People would hear about the emergency rooms, the schools, all the public, access services. So how do you understand what's happening in California, and what does it mean to you in terms of the overall structure of what's happening with Medicaid?
California is fine. We rely significantly on taxing wealthy people on capital gains. The depression in the stock market will hurt California over the next 10 years. You cannot treat a family by only treating some family members. If you don't treat COVID in a woman without documents, then her children who are U.S. citizens are going to get COVID, and that's going to be much, much worse. To put this idea that the state of California is going down the tubes and it's undocumented immigrants that are the reason is simply absurd. California is going to do fine, and we're going to make sure that the people who live in California is healthy. Also, it's absolutely wrong to say that every undocumented immigrant gets Medicaid. Or Medi-Cal, as we call it in California. The rules for eligibility do not say, well, if you're here illegally, you get special treatment. But we do make sure that the people who live in the city of Los Angeles have the basic health care that they need so that we all don't get infectious diseases.
Kevin, what's your response?
Well, it is absolutely true that every illegal immigrant who would otherwise meet the income threshold for Medi-Cal is given comprehensive coverage in California. And if this is the right policy, it raises the question, why is California the only state in the country that doesn't? There's no other state that has come close to what California has done. And the reason other states haven't done this is because it is fiscally unsustainable, and because what has happened, where the cost has absolutely spun out of control, was utterly predictable. In fact, it actually costs more to provide coverage in a lot of cases for an undocumented person than for a legal resident. For example, because prescription drug rebates that exist at the federal level, where the federal government is able to negotiate those rebates don't exist when you're providing coverage to illegal immigrants using only state funds. And so this is a policy that absolutely has to go.
We balanced our budget in California
Brad, I give you
each
the
and
last
every
word.
year.
Go ahead.
We balance our budget every year in California. Now, the federal government can't because you have these enormous tax cuts that were locked in 2017. Republicans haven't cooperated with us in getting rid of them, and now they want to extend them and make them bigger. And the result will be the instruction to the Energy and Commerce Committee that it must cut nationwide Medicaid by $880 billion. So we balance the budget in California every year. This federal government wildly in deficit, now going to be incredibly fiscally irresponsible under a budget plan that every Democrat voted against. We're doing fine in California. The federal government has really big problems.
Hey, thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget, click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.